Hi, everyone. My name is Hayley Koslik. Again, I'm a public health analyst on the NHSN AUR team. And today I'm going to give a guide to the NHSN's Antimicrobial Use or AU Option Report and the Antimicrobial Resistance and Patient Safety Portal. I'm going to stop my video just to save some bandwidth, but let's jump into it. All right, so at the conclusion of today's session, you should be able to describe the function of the standardized antimicrobial administration ratio, summarize the components of the NHSN antimicrobial use option report, and navigate the antimicrobial resistance and patient safety portal. Before we get into the NHSN AU option report and patient safety portal, we need to understand the foundation on which they're built, and that's the SAAR. And if you aren't familiar with what the SAAR is, it is the Standardized Antimicrobial Administration Ratio, and it's a standardized metric of antimicrobial use, or AU, available to facilities reporting data into the NHSN AU option. It's a ratio comparing observed or reported antimicrobial use to antimicrobial use predicted by a referent or baseline population. And it's calculated by dividing observed antimicrobial days by predicted antimicrobial days. And the SAAR enables hospitals to track their AU over time, make risk-adjusted comparisons among similar patient care locations to national benchmarks, and evaluate the impact of interventions targeting prescribing practices. So really useful tool. And when we're talking about a baseline or referent population, we're referring to the calendar year of NHSN data used to develop the SAAR models. The SAAR referent population is AU data that's been aggregated from select patient care locations reporting to the AU option during the baseline year. And then NHSN uses these data to develop SAAR predictive models from the same group of patient care location types. Separate predictive models are developed for each specific antimicrobial agent category, which we'll get into in a little bit. And NHSN develops new models every few years. This is also known as rebaselining. These new prediction models allow us to increase the number of patient care locations modeled and assess AU risk in more settings, as well as update the antimicrobial groupings and ultimately provide more precision in our estimation of predicted antimicrobial use. The SAAR can be generated for 17 specific NHSN location types listed here, 8 adult and 5 pediatric, both from the 2017 baseline year, and 4 neonatal from the 2018 baseline year. Eligible locations are determined based on availability of data in the baseline year and clinical relevance. 2 things to note. None of these SAAR location types contain AU data from all inpatient locations in a given facility. This is referred to as facility-wide inpatient or FAC-wide in. And then also outpatient acute care settings, and for the AUR module, that's outpatient ED, pediatric ED, and 24-hour observation areas are currently not SAAR eligible locations. But in the future, as more facilities submit AU data, the NHSN team plans to develop SAARs for additional location types. The SAAR uses 7 adult and 8 pediatric antimicrobial agent categories. These categories include all antibacterial agents, broad spectrum antibacterial agents predominantly used for hospital onset infections, broad spectrum antibacterial agents predominantly used for community acquired infections, antibacterial agents predominantly used for resistant gram-positive infections, narrow spectrum beta-lactam agents, antibacterial agents posing the highest risk for Clostridioides difficile infection, antifungal agents predominantly used for invasive candidiasis, and additionally azithromycin for the pediatric population. And these antimicrobial agent categories are determined by CDC based on published reports on stewardship efforts and with the input from our external antibiotic stewardship experts. The SAAR can also be generated for 7 neonatal antimicrobial agent categories. That is all antibacterial agents, vancomycin predominantly used for treatment of late onset sepsis, broad spectrum antibacterial agents predominantly used for hospital onset infections, third generation cephalosporins, ampicillin predominantly used for treatment of early onset sepsis, aminoglycosides predominantly used for treatment of early onset and late onset sepsis, and fluconazole predominantly used for candidiasis. So now we'll move into our first knowledge check. So how can hospitals use the SAAR? A, to track their antimicrobial use over time. B, to compare their antimicrobial use to a national benchmark. C, to assess the impact of their stewardship interventions, or D, all of the above. And I'll give you a moment here to think through your answer. All right, and the correct answer is D, all of the above. So hospitals can use the SAAR to track their antimicrobial use and compare their use to a national benchmark, as well as assess the impact of their stewardship interventions. So now that we've refreshed on knowledge of what the SAAR is and how it can be used, let's move into the NHSN AU option report. The AU option report provides a summary of AU data submitted to the NHSN AU option, and it uses the SAAR as its primary metric. The report includes 1 year's worth of data from acute care hospitals that reported at least 9 months of data from SAAR-eligible locations. It provides a summary of SAAR distributions and antimicrobial use within SAAR agent categories for adult, pediatric, and neonatal patient care locations. And this report can really help to inform antimicrobial stewardship efforts and benchmarking by showing hospitals how their SAARs compare to the national and state-specific distributions. So in summary, putting it all together, it turns AU data submitted to NHSN into a strategic stewardship action. And there are two elements to the AU option data report. The first is a PDF document shown here, and this provides an executive summary that discusses the importance of monitoring AU within antimicrobial stewardship programs, as well as background on the SAAR, much of what we've gone over today, a high-level comparison of SAARs over time, median and pooled mean SAAR values by population, location type, and SAAR antimicrobial agent category, percentages of AU by antimicrobial class and drug for each population and agent category, and a discussion of best practices to utilize these data for informed targeted stewardship efforts. The second piece of this report is the accompanying Excel data tables, which give a little bit more detailed information about the SAAR distributions and percentages of AU. It includes information on characteristics of the NHSN acute care hospitals that are reporting for each population's SAAR locations, the SAAR distributions for each population and SAAR antimicrobial agent category by location, percentage of AU by antimicrobial class and drug for each SAAR agent category and location as applicable, and SAAR distributions by state. Time for another knowledge check. So true or false? The NHSN AU option report provides a summary of SAAR distributions and antimicrobial use within SAAR antimicrobial agent categories for adult, pediatric, and neonatal patient care locations. And again, I'll give you a few moments to think through your answer. All right, and big reveal, this statement is true. So the 2023 NHSN AU report was posted last month with some additions that I wanted to highlight now. This is going to be a high-level overview, so we won't have time to get into all the details, but I encourage you to check out the report for more specifics, and I'll provide a link to that at the end of this. So coming in 2023, there's been a steady increase in the number of facilities submitting data to the NHSN AU option, and this is shown in the graph on the left. In 2019, a little over 1,200 facilities reported 9 or more months of data for at least one SAAR eligible location. And by the end of 2023, a little over 2,400 facilities were reporting. Similarly, the number of eligible reported patient care locations has increased, shown in the graph on the right. For example, around 4,000 eligible adult ward locations were reported in 2019, and this jumped to 7,100 in 2023. So because of the increase in reporting facilities, the 2023 AU option report includes data from more facilities and patient care locations than in previous reports. The increase in hospital reporting is probably in part due to the publication of the CMS final rule for Medicare Promoting Interoperability Program, which made that AUR surveillance measure a requirement for 2024 under the Public Health and Clinical Data Exchange Objective. But although this mandate didn't impact the period of data for the 2023 report, it probably contributed to increased AU option enrollment at the end of 2023. So shown here is the percentage of hospitals reporting at least 1 month of data to the AU option among acute care hospitals by state or jurisdiction as of January 1st, 2024. 3,236 facilities reported at least 1 month of data to the AU option, and participation ranged from 13% in Puerto Rico to 76% in Maine. The 2023 AU report also includes SAAR distributions among reporting locations by these select antimicrobial agent categories, including all antibacterial agents, broad spectrum antibacterial agents predominantly used for hospital onset infections and those for community acquired infections, and antibacterial agents predominantly used for resistant gram-positive infections for adult eligible ICUs and wards from 2019 through 2023. SAAR distributions can be used to identify where a facility's SAAR lies compared to other facilities. We also provide SAAR distributions among reporting locations by these agent categories for pediatric eligible ICUs and wards from 2019 through 2023. And I do want to mention the increase in reporting this year in 2023 also allowed us to calculate full distributions among specifically pediatric medical ICUs for all SAAR types for the first time. And lastly, SAAR distributions among reporting neonatal locations for the following antimicrobial agent categories were also added for 2019 through 2023. This included the all antibacterial agents category, vancomycin predominantly used for treatment of late onset sepsis, broad spectrum antibacterial agents predominantly used for hospital onset infections, and third generation cephalosporins. So SAAR data should not be compared year by year. Year to year visual comparisons of SAARs are subjective and may not represent a statistically significant difference or a clinically meaningful change. Changes over time in SAARs may be attributed to a number of things, and this list isn't exhaustive, but the COVID-19 pandemic, which led to shifting characteristics of inpatients, changes to prescribing practices due to antimicrobial stewardship efforts, changes to the composition of hospitals submitting data to the NHSN AU option, availability of antimicrobial agents, and activities of diseases that could impact antimicrobial use. So one example kind of highlighting this, you may have noticed on a prior slide, there were higher broad spectrum antibacterial agents predominantly used for community-acquired infections, or BSCA SARS, among pediatric ICUs and wards in 2023 compared to 2022. But upon further investigation, use of beta-lactamase inhibitor agents increased among these hospitals, specifically amoxicillin/clavulanate acid and ampicillin/sulbactam. And this increase coincided with a surge in respiratory illness and national amoxicillin shortage in late 2022, which may have contributed to a higher use of amoxicillin alternatives for pediatric patients. We also saw some updates to the state-specific SAAR distributions for 2023. For states with less than 10 facilities reporting, percentile data is omitted due to insufficient data. For states with 10 to 19 facilities, only median values are shown, and for states with at least 20 facilities, full distributions are displayed. So in 2023, we had a few states cross that threshold of 20 facilities reporting, allowing us to calculate full percentiles when we previously could not in 2022. And among those were adults for Arizona, Connecticut, Kansas, New Mexico, and Nevada, and among neonates for Pennsylvania. Now, while the AU option report provides a very comprehensive overview of AU data submitted to NHSN, the antimicrobial resistance and patient safety portal allows you to explore that data in a more interactive way and is meant to complement it. So the portal allows users to view the 2021 through 2023 national and state-specific SAAR data with enhanced geographical visualizations and charts. Here is the Antimicrobial Resistance and Patient Safety Portal homepage. You can access this page from the link here on the slide. It might look slightly different than what's shown here, as there's been a couple recent updates to the website, but the general structure is the same. So from here, you'll notice you can select a number of different pages to view other data collected through NHSN and other sources. And I do want to note that at the moment, the AUR module does not provide any antimicrobial resistance data to the patient safety portal. That information is currently derived from HAI data and other sources. But to get to the SAAR data, you'll first select the antibiotic use icon. Next, you'll land on the antibiotic use homepage, and from here, select inpatient antibiotic use, all SAAR agent categories shown in the bottom left. And then you'll arrive at the inpatient antibiotic use homepage, and from here, you can find the national and state-specific SAAR data reported to NHSN from 2021 to 2023. To go directly to this page, follow the link at the bottom of this screen. So let's see that in a demonstration. So starting on the patient safety portal, you'll select the antibiotic use icon. Once you're redirected, select inpatient antibiotic use, all SAAR agent categories. And you'll arrive at our inpatient antibiotic use homepage where you can locate those national and state-specific SAARs for 2021 through 2023. Once on the inpatient antibiotic use homepage, if you scroll down to the first map, you're able to view facilities reporting SAAR by state. And then hovering over each state, you're able to view the number of facilities reporting SARS in that state, the number of facilities eligible to report SARS, and the percentage of eligible facilities reporting. The left-hand navigation bar allows you to toggle between years and population. Let's walk through another quick demo. So starting on the inpatient antibiotic use homepage, scroll down to the first geographic map to see states reporting SAAR. And then you'll hover over a state to view the state-specific participation. And then use the left-hand navigation to select the year and population of interest. And once a selection is made, the map will refresh in real time. Under the participation by state map is another map that displays median SAAR values by year, population, SAAR agent, and state. When you hover over each state, you're able to view that state's median SAAR and confidence interval. On the left-hand navigation bar, you can adjust between years, population, and SAAR antimicrobial agent category. Full SAAR agent category names can be found in the footnotes at the bottom of the page. Shown here is an example of the median SAAR value in 2022 for the all antibacterial agents SAAR category for the adult population in Texas. And if you prefer to view the same information just displayed in a different format, the same information is also displayed below the map in an alphabetized state list. To view your state's median SAAR as compared to the national median by SAAR agent category, you can select a state from the previous map I just showed you, and you'll be redirected to this page. Hovering over a bar, you're able to view the median SAAR for the state or national SAAR, as shown here. SAAR agent categories are shown on the horizontal or x-axis. As before, you can select the population and year on the left. So now shown in real time. So from the inpatient antibiotic use homepage, scroll down to the second geographic map to see SAAR data by state. Once there, you'll hover over a state to view its median SAAR and confidence interval. And then use the left-hand navigation pane to select year, population, or SAAR agent category. To see the state's comparison to the national SAAR, you'll select a state. So here I'm selecting Georgia. From there, you'll be redirected to this page where you can view the state and national median SAAR by antimicrobial category. Going back to the homepage, you'll scroll below the geographic map to view that same SAAR data in a different format. As before, you can make adjustments on the left and the chart will update in real time. All right, this is our last knowledge check. True or false? The Antimicrobial Resistance and Patient Safety Portal provides national and state-specific SARs. And this statement is true. So here are some additional resources that can help orient you to the topics we discussed on today's session. For more information on the SAAR, I recommend checking out the NHSN's Guide to the SAAR, this first link here. To view past AU data reports and where the most recent 2023 report is posted, you can check out our AUR module reports, the second link here. And lastly, here's a direct link again to the Patient Safety Portal Inpatient Antibiotic Use homepage. So thanks so much for attending this session on the AU option report and AR PSP. If you have any questions or concerns related to these session topics, you can post them in our annual training community. And again, as others have iterated outside of the annual training today, you can submit them to the NHSN ServiceNow if you have a SAMS account. Otherwise, you can email the AUR team at nhsn@cdc.gov.